New cases of COVID continue to go up, unfortunately, in Ealing, across the capital and the country. For the week up until the 13th of September, we've had 100 new cases of COVID-19 in Ealing. That's 29.3 per 100,000 of population. So with this increase, we're now sixth highest in London. Redbridge are the highest with 39 cases per 100,000. Hounslow, Barking and Dagenham, Enfield and Havering are above us with over 30 new cases per 100,000 or above as well. Now we're above the London average of just under 24 per 100,000, and we're just below the England average of 33.3 new cases. Now, the week of the 4th of September, there were no COVID deaths in Ealing, and obviously that's good news. There are limited hospital admissions at the moment as well, but clearly if the cases continue to rise as they're doing, then that is not going to remain the same. We will have more hospital admissions and we will have more deaths, sadly. So everybody needs to make a really extra effort to think about protecting the most vulnerable in our borough and doing everything that they can to stop the spread of the virus. Now, these numbers in terms of new COVID infections are also underplaying the numbers. We've had problems getting tests this week, both in Ealing and right across the country. It's the same. And so we are undercounting the numbers of people in the borough who have got COVID. People are having a difficulty getting tests, and the number of tests available in the borough has been reduced in the last week, and many people are frustrated trying to book tests. As a result, I've written to Matt Hancock, the Secretary of State for Health, raising my concern and saying that we need more testing urgently, especially for our children in our schools and the vulnerable in our care homes. Now, with a shortage of available tests, the key message is to only try to book a test, and you can either do that online or by calling 119 if you are experiencing COVID-19 symptoms. Obviously, you know the symptoms: a temperature, a new persistent cough, and a loss or change of taste or smell. Now, while you're waiting for a test or waiting for the test results, you need to self-isolate. Other members of your household should also be isolating during that period. But if they're not actually experiencing COVID symptoms, they shouldn't get a test. Only those with symptoms should get a test at the moment. Now, to stop the spread of the virus, we need to remember the message: hands, face and space. Wash your hands regularly, use a face covering when social distancing is not possible, and try to keep your distance from those not in your household. We need to also follow the new rule of 6, not meeting socially with more than 6 people inside or outside. And if we do all of these things, we can stop the spread of the virus and keep Ealing safe.